terms of, because we hear a lot of spinal injuries, but rarely do we hear infections of the spine. Yeah, so when we talk about spinal infection then, is it the same as spinal injury or there is a difference?
Those are two different concepts and disease entities.
All right.
Spinal infection, basically we're just talking about infections that afflict the spine. And as I earlier alluded to, what's the spine? The spine is composed of many structures. There are the bones, the vertebrae, the intervertebral discs, there's the spaces, the epidural space, there are the meninges, you know, the ones that enclose the spine. And then you have also the spinal cord itself, which is bathed in a fluid called the cerebrospinal fluid. And then at the bottom there, from just around the lumbar vertebrae, there is what we call the cauda equina, where the sheaths of nerves that come out and go to the lower body and to the lower limbs. All this can get afflicted, can get infected.
All right.
Yes.
Okay, how so? Because, you know, when you think about it and the structure of the spine itself and the location, you might think this is like one of the most protected, you know, structure,
yes.
You know, of the body. So infection, like how then does the infection part then come about?
Okay. It is very protected, as you alluded to. There are also the muscles that surround the spine.
Yeah.
But in a way, there are different ways that the infection can get to the spine.
All right.
One way is a hematogenous route, where we get infections, maybe from the toothache, where you have an abscess. You can get a sore throat. The bacteria or the fungi goes through the bloodstream and lodges itself into the spine. The other way is just directly, where maybe you get an injury around, like when you have spinal trauma, and you get an injury and then you get an open wound. You can have a direct inoculation of the organisms, the bacteria and the fungi and the viruses. And then there's where the infection can come from contiguous structures, basically structures that are next to it. You see, you can have a kidney infection, gets an abscess, and then maybe spreads to where the spine is. So you can spinal infection.